Welcome to The Explainer. Today, we're going to tackle two words you've probably heard a lot: panic and anxiety. They get used almost interchangeably, but it turns out they're actually medically distinct. And figuring out that difference, well, it's not just about using the right words, it's really the first step to understanding what's going on in your own mind and body. So, have you ever been there, that sudden, overwhelming wave of fear? Or maybe it's more like a cloud of worry that just will not lift. And you've asked yourself, what is this? Am I having a panic attack, or is this an anxiety attack? You are definitely not alone in that confusion. The feelings are so intense, and they can be really, really hard to tell apart. And that right there gets to the heart of the matter. While both can feel completely all-consuming, they actually have different triggers, and they play out on totally different timelines. Nailing down those key differences is what gives you a sense of control and helps you figure out how to respond. All right, so let's really dive in. To see the difference clearly, we got to look at a few crucial things: how they start, how intense they feel, and how long they decide to stick around. This is where you really start to see them pull apart. Okay, so this is where the picture gets super clear. Just look at how they begin. A panic attack can come out of absolutely nowhere, like a lightning strike. But anxiety, that's more like storm clouds gathering on the horizon. It builds slowly, and it's often tied to a specific worry. The intensity is night and day. Panic is this intense, disruptive peak, while anxiety can be a low, constant hum. But maybe the biggest difference is the duration. Panic is usually over in minutes. Anxiety, though, can settle in and stay for days, weeks, or even longer. So it totally makes sense that these differences in timing and intensity mean they feel different too, both physically and mentally. Some of the symptoms might overlap, sure, but the overall experience is pretty distinct. Now, before we break down the symptoms, there's a really important distinction we have to make. You won't actually find the term anxiety attack in the official diagnostic manual, the DSM-5. It's more of a common phrase we use to describe a period of intense anxiety. A panic attack, on the other hand, is a specific, clinically defined event, so that's a key difference right there. A panic attack is an all-consuming physical event. Your heart is pounding out of your chest, you can't catch your breath. It can honestly feel like you're having a heart attack. And all of this peaks within just a few minutes. But what truly sets it apart is the psychological terror, that intense feeling that you're detached from reality, that you're losing control, or even that you're about to die. Anxiety, on the other hand, it plays the long game. The symptoms might be less severe in any single moment, but they are persistent. Think of that constant nagging worry, the irritability, the trouble focusing your thoughts. It's that feeling of impending doom that just kind of hangs around, sometimes for days or weeks at a time. Okay, so now that we've got a handle on the what, let's talk about the why. Looking at what can trigger these events and who might be more at risk is just as important for understanding the whole picture. It's almost never just one thing. Both panic and anxiety can be set off by a huge range of triggers. Some of them are real threats, others are just perceived threats. We're talking about things like high-stress jobs, side effects from medication, chronic illness, specific phobias, even something as simple as having way too much coffee. And, some things can make a person more vulnerable. Your risk might be higher if anxiety or panic runs in your family, or if you're already dealing with other mental health conditions, or even if you have chronic medical issues like a thyroid problem. And past trauma also plays a huge role. Now, these aren't guarantees, of course, but they are known risk factors. And check this out. Here is a fascinating and really significant piece of data from the research. Women are twice as likely as men to develop an anxiety disorder. That's a huge difference, and it really points to this complex mix of biological, social, and environmental factors all playing a part. Okay, now for what might be the most important part of all of this. The really good news is that while these experiences can feel incredibly scary, they are absolutely manageable. There are super effective strategies for dealing with these feelings, both right in the heat of the moment and for your long-term well-being. So if you feel one starting to come on, try to remember these 4 steps. They can be incredibly powerful. First, just acknowledge what's happening. Tell yourself, okay, this is happening and it will pass. Second, bring all your focus to your breath. Slow, deep breaths can calm that fight or flight response. Third, try to release physical tension. Even just clenching and unclenching your fists can help. And fourth, ground yourself in the present moment. Notice what's around you to pull yourself out of the storm in your head. But look, coping in the moment is just one piece of the puzzle. Long-term management is where the real change happens. This can include lifestyle adjustments that make a huge difference, like getting enough sleep, limiting caffeine, and building a solid support network. And of course, professional help is key for so many people, from therapy like CBT that helps retrain your brain's responses, to really effective medications like SSRIs. So if there's just one thing you remember from this explainer, let it be this fundamental difference. Panic is an abrupt, intense, short-lived storm. Anxiety is the whole weather system that can build slowly and linger for a long time. Knowing which one you're dealing with, well, that changes everything. So now you have this knowledge, which makes the path forward so much clearer. Maybe your next step is trying one of those breathing techniques. Maybe it's reaching out to a friend you trust. Or maybe it's making a call to a professional. Whatever it is, that next step is yours to take.